Hi, and welcome to Policy Unpacked, a podcast by Global Policy Network. In this series, we dive into the policies shaping our world, from healthcare to sustainability to education, and explore how these critical areas intersect to drive meaningful change. Whether you're a policymaker, a practitioner, or just policy curious, we're glad you're here. Let's unpack policy together. So my name is Amina Ghazal-Sachi. I'm the founder and CEO of Global Policy Network, and I'm here with Shilpa Shah, CEO of North East London LPC. So welcome, Shilpa. How are you today?
I'm good, thank you, and thanks for having me on your podcast.
It's a pleasure. So you've been a pharmacist for 25 years, focusing your entire career on community pharmacy. What drew you to the sector initially, and what keeps you passionate through all the changes in the sector?
Yeah, I think growing up, it was always sort of ingrained in me that I would need to get a degree in something that led to a job at the end of it. So, growing up in a typical Asian family, it was very much sort of accountancy, optometry, pharmacy, those sort of careers that we were sort of guided into doing our degree in. But my parents actually had a newsagent in a local community, so in East London. And growing up, I used to work there. I used to help them in the shop. I used to get to know the customers. So once I knew that it was pharmacy that I was going to, do my degree in, I also just knew deep down that it would be community pharmacy because I love the whole working in the community, getting to know the people that are, your regular patients that come in, and also just the business side of running a community pharmacy as well. That's what's really interested me. What's kept me in this role, because actually in the 25 years I've been doing this, there's been so many other roles that have opened up. When I qualified, it was really only hospital, community, and a few people went into industry. But now obviously there's pharmacists that work in GPs, there's ICB pharmacists, there's prison pharmacists. There's so many different roles you can go into. But I think ultimately everything I do or want to do is about making things better for local residents and communities. So for me, by looking after the 375 pharmacies we look after in North East London, if I can help them be the best that they can then pass that on to all those residents in their local communities. So that's helping almost 2.2 million patients across North East London.
That is amazing. I love it. I love your history. I love how it shaped you and all the great things you're doing. You've worked also for two large retail chains, apologies. So working yourself up to a leadership position, what were the biggest milestones in your journey and how did they help you develop into who you are today?
I think the first biggest milestone was when I did my pre-registration year, which is now known as trainee pharmacist year. I had an amazing tutor, Jim Thomas, and he really helped develop my passion around the business side of pharmacy. So as well as obviously having to study and learn everything and pass my pre-reg exam, I also my eyes were opened up to the world of kind of merchandising, payroll, HR issues, etc. So I really just got a really varied experience in my first year. And actually my first biggest milestone was almost 3 or 4 weeks after qualifying as a pharmacist. I was offered my first store manager position, which in those days was quite rare to be offered something so quickly. But actually I knew that's what I wanted to do. And it was a small store, and it really gave me the opportunity to, having a few staff, learn everything that I needed to learn. And from there, I think that just galvanized me to just kind of moving around, the multiple to kind of get different experiences in different size stores. And I ended up my career, and this was with Boots, in a top 300 store, which again was just very big on retail, but also huge on pharmacy. We were developing new services because it was one of their top 300 stores. Any of the new services were almost piloted and given to that store to do. And so I learned so much. And for me, the biggest things that helped me develop in the person I am today is having some amazing role models and having some great advocates who really pushed me to be the best that I could be. Conversely, I've also had some leaders who I have learned that's not the way I'd like to lead people. So while times have been a little bit tough, maybe working for different leaders, it's allowed me to experience lots of different leadership styles, which has helped me develop the kind of leadership style I want to, the kind of leader I want to be compared to the kind of leader I don't want to be. And so that's really helped me as well. And all the courses as well. When you work for large multiples, they have some really good leadership courses that you can go and attend. I think ultimately, You can learn as much theory as you want, but deep down, the person you are is the person you are, and it's about being that authentic leader. And again, that's something I've learned over the past few years, just being myself in leadership.
That's fantastic. And 3 years ago, you became the CEO of Community Pharmacy North East London. So, following your time at Kent Pharmaceutical Committee, so what motivated you to take on this role, and what has been your biggest achievement?
Yeah. So I was the CEO at Kent LPC, and then this position came up in North East London, and the person who was here before me had been doing it for very many years, and I just thought I want to work in a place where I live, so that I know that I'm actively helping the pharmacies be the best they could be, as I said, for the residents, but I'm part of that. So for me, it's the community I live in that I am
Mm,
serving. So I knew that I just had to go for the role. I had to absolutely go for it. And I thought if I didn't go for it at the time, someone else could get the job that might be there for another 20 plus years. So my time would, be gone, sort of thing. So I thought, what have I got to lose? I loved the job that I was doing in Kent. The actual role was brilliant. I'd learned so much. But once I knew North East London came up, where I've grown up my whole life, I went to school in East London. I learned how to swim. I went to college. All my friends, neighbours, etc. I knew that I wanted to work here. So I got the job, which was brilliant. And I suppose my biggest achievement, we won in, was it 2023? We won an award for the best supporting LPC with the Independent Community Pharmacist magazine, and that was a really nice achievement because we'd won it previously in Kent as well, but actually coming to an LPC where I had to make quite a few different changes. I had a whole new team, really developing those relationships with key stakeholders. It was nice to be recognised in that way.
and well done, fantastic. And what's your priorities and vision now for the organisation?
I think our priorities is, as I said, to help the pharmacists be the best they can be. There are so many different services out there. There's a lot of national services. And we are actually the highest performing LPC in London, and also the country for a lot of these services. So how do we continue that journey? How do we ensure that everyone is the best they can be? How do we support all our pharmacies and pharmacists to become independent prescribers, because we know that's what the future is going to be? How do we help them navigate through all the different challenges that they're facing, whether it's financial challenges, workforce challenges, challenges in changing, like I said, moving on to becoming independent prescribers? That's a huge change. Hub and spoke that's coming in could be a huge change for community pharmacy. And for me, it's about how do I support them through that. But my absolute priority is by making sure the pharmacies are providing all the different services to the top of their license, so that they're helping their residents. And part of that is also, as well as the national services, having innovative local services. So recently we've just completed a service, has just ended, and we're evaluating it at the moment, but it was just in one particular borough in Newham, where we know that we've got high levels of pollution, so how do we look at children with asthma in Newham, but in a different way? So we did a bit of inhaler technique, that's something we would always do, but how do we start talking to them about, where are you living? Are you living in housing that's damp, or are you living with someone who smokes in the house, which obviously might not be the child, but could be one of the carers, parent or guardian? And what about the route that you go to school? Do you walk across the main road where there's a lot of pollution? So really taking a holistic view. And I'm really looking forward to the evaluation of this service, because I think by running these services and being innovative just allows us to show absolutely what community pharmacy can do.
Absolutely. And what do you think are the biggest misconceptions about community pharmacy today?
I think the biggest misconception is mainly from the public thinking that we're a shop. And that, don't get me wrong, you do go into some of the big multiples and you can buy your makeup, you can buy like a meal deal for lunch. But actually, at the heart of that business is a pharmacy. And that's what draws people in, into the pharmacy to get that healthcare need looked after, whatever it might be. And I think one of the biggest misconceptions is that people think that they need to go to the doctor first, and actually we're really encouraging people to go to pharmacy first, because actually we can triage people. We're like the front door to the NHS. I've heard people say that we can triage them, and if we think you need to go to a doctor, we'll send you to a doctor, but actually you might need to go to an optician, you might need to go to a dentist, or we might be able to help you. Majority of the time we can help you in the pharmacy.
That's fantastic. And just on that, so community pharmacists are at the front line of primary care. Do you think we are doing enough to enable community pharmacists to deliver all that's expected of them?
Do I think we're doing enough? I think that we could do a lot more. So, I think that we do need, we know we need core funding to be better so that we can, use that funding to employ the right team that we need around us. That, as I said earlier, everyone can work to the top of their license. So there's absolutely stuff that can be done at government level, and we have a negotiating body, Community Pharmacy England, that are working on that, and they've negotiated a new contract, which is a step in the right direction. So hopefully that journey will continue. I think on the ground, this is where local pharmaceutical committees come into their own, and they're really responsible for helping develop those pharmacies, and the pharmacy teams and the pharmacists to be the best that they can be. So that we can help them deliver. I think that the government needs to help us as well. I think that if we could, for example, say that all vaccinations can be done in community pharmacy, I think things like that would be a game changer. I think that it would mean that GPs could free up their time to do other things with their patients, but also we know that vaccination after clean water is one of the biggest movements in public health in saving lives. So actually, why wouldn't we want people to be able to walk in on a Saturday, to walk in on a Thursday evening after work, after the kids have finished school, etc., and get all their vaccinations at a time that's convenient for them at premises pretty much within 20 minutes of where they live, without having to make an appointment. So I think there's a lot more that can be done to help us ensure that we deliver everything that's expected of us to a high standard and a high level.
Absolutely. And where do you see the most untapped potential in the sector, either in services, partnerships, or workforce development?
So I think an example I just gave at the moment when I talked about
Mm.
vaccinations, I think that's a massive untapped potential in the sector. I think that that's something we could easily do. I think also where we're missing a trick, and I know the government are now looking at that. There's going to be a consultation coming out later on this year around looking at pharmacists being able to change prescriptions when a medication is out of stock. So at the moment, we've got a lot of medications that are out of stock and we can't change the prescription. We have to send it back to the GP and ask for something else. By the time that process all happens, often that drug's also gone out of stock or that
Mm.
strength has gone out of stock. Wouldn't it be great if we could just make that amendment in the pharmacy as independent prescribers, which the majority of pharmacies will be over the next few years, or in some other way that we're allowed to make these changes, so that we can really help the patient very quickly. I also think around workforce development, I think that, we know that GP surgeries or PCNs get something called Rs funding, where they are funded for some of the staff that they have. I think that that could be a huge game changer. And I've been saying this for a couple of years now. If we were able to be funded for a pharmacy technician, for a pharmacist in every pharmacy that was there purely to deliver all the different services that are available, we could do so much more in community pharmacy. And that's what I'd like to see happen in the future.
And what about technology and AI? It's fast evolving. What role do you think it should have,
Yeah.
in terms of the future of community pharmacy?
Yeah. I think that all of healthcare, not just community pharmacy, is moving way too slowly on the technology and AI front. And I absolutely get why, because obviously, we're dealing with people's health and we've got to be really careful. But there is so much we can do. And don't get me wrong, like people have started doing that. So clinical note taking, there's AI tools that can help you with that. PMR systems, the patient medication record systems in community pharmacy often use different AI and technology. And so we're moving in the right direction. I would love to see it move quicker, with pace, but obviously with all the right governance checks in place to make sure that it's all safe for the patient, because ultimately that's what we need. But again, there is so much we could do. How could we use AI tools so I talked about vaccinations. When somebody has a vaccination in the pharmacy, there's quite a lot of paperwork they have to fill out before they have it to make sure that that's
Mm.
suitable for them, to make sure it's safe. Now, you don't need to do the exact same in the GP surgery because they've already got all your records, etc. there. But is there a way that we could do it where, we use tech to help the patient fill it out, especially working in North East London where English isn't often people's first language? how can we use technology to help them fill it out, which would free up again staff time, wouldn't it, to be able to do something else while the patient's filling out that form, or allow us to do more vaccinations because we're not constrained by time limits.
Absolutely. So is there any technology or innovations that you've heard of that are being used that really excite you, that you think that should be, implemented or focused on this year or into the future?
Yeah, so I think definitely there's some PMR systems out there which are amazing. I won't name one over any others, but
Yeah.
there are some PMR systems. Now, again, it's quite difficult when you're in a pharmacy. You can't just change your PMR system just like that. You're tied into contracts, etc. But I would like to see all the current PMR providers get to that standard and get to that level, because what I have seen is that it is speeding up the way medication is dispensed and processed for the patient. Again, we use robots in some pharmacies, and there's a level at which how many items you dispense where a robot becomes viable for you to get. But actually, those robots are evolving all the time as well. So could we make sure that we're using those? And again, the current suppliers of robots, are they keeping up with that technology to match some of the new kids on the block? So I think that those sort of areas are places that we really need to look at.
Sounds very exciting, especially robotics. So you volunteer both as a listening volunteer with the Samaritans and as a pharmacist with Crisis at Christmas. Why are these charities important to you, and what drives you to get so closely involved with them?
Yeah, I think for me, the ethos of the charities is about helping people. And I feel that having kind of a background in healthcare, it draws me to these charities. I mean, Crisis at Christmas, I am a pharmacist. I'm now a deputy healthcare manager for them. And it started off about me just being a pharmacist for them. And then I went on to be a team leader. So for me, it's about utilising my professional paid skills to offer in the charity sector. With Samaritans, it was more actually 10 years ago, I was looking to volunteer in my local community, and I sort of typed in what opportunities were available, and it happened that they had an information evening that particular week. And I'm the kind of person, if I want to do it, I want to get it done there and then. And it just snowballed from there. So I went to the information evening, and then I had an interview, and then I started my training with them. But again, I see lots of synergies between what I do in pharmacy in the healthcare world and what I do at Samaritans. And the biggest thing, I think, is the skills that I've had at Samaritans around listening. It's really changed the way I listen, not just to patients in a pharmacy, but also to my friends and family and people around me. It's about us. We talk about it in pharmacy about asking open-ended questions, but sometimes when you're busy and there's people in front of you and you just want to know if there's a specific symptom or red flag that the patient is experiencing, so you know what medication to give them or what not to give them, it's easier to often ask a bit of a closed question. Whereas Samaritans has really taught me the importance of asking open questions. And yeah, I think that's a massive skill. And the other skill I've learned, the biggest skill I've learned from Samaritans, is about silence, and sometimes just pausing and taking a breath. And that's to gather your thoughts, to give the other person real opportunity to maybe say something that they weren't going to say without you interjecting. So those are the sort of skills I've learned. And I think they just tie in really well together. I didn't actively go out to do that, but it was just as I started becoming a volunteer, I realised the crossover between the two fields.
That's fantastic, and I love that you're applying it both to your own personal life and at work as well. And if you could change one thing about the way community pharmacy is perceived or supported, what would that be?
I think I would like everybody, and this is from the government to Treasury to the public, to see that we are accessible because we're on the high street, but we're not just another shop on the high street. So when you come in, when you go into a community pharmacy and you're sort of like, oh, how long will it take? And surely it's just that box over there. It's not the same as going into a supermarket and buying a jar of pasta sauce. Like, this is medication. It's really important that we do all our checks and balances to make sure that you're getting the right thing that will help you, rather than anything that could cause harm. So that's more for sort of the public to understand the role that we play. We're not just a shop on the high street. Also to understand all the different things that we can do. And I'm not sure how how we can do that. I mean, obviously, every pharmacy needs to advertise their services because every pharmacy does different things. I think the government could play a big part in that as well, like really, encourage patients to go to the pharmacy first. And I think that just needs to be a huge government campaign. It's not just about going to the pharmacy first, but it's about knowing what is the right healthcare professional that you need to see for your condition. So again, could the government use a bit more AI, which they are now with NHS 111 online? It's kind of an AI tool where you put everything in and it triages you and sends you to the right person at the end. But could we have more things like that when you're just looking up symptoms? Could it be like, actually, who do you need to see? Fill out this survey and we'll tell you need to go to. So I would just like to see us perceived as seriously as other healthcare professionals, like, people that work in general practice. We often talk about pharmacists that work in general practice as clinical pharmacists. We've done the same degree. We are also clinical pharmacists, and now more and more community pharmacists are doing independent prescribing courses. They're at the same level. So how do we use the word pharmacist and not clinical pharmacist, or we use the word clinical pharmacist for everybody out there?
And what gives you hope for the future of pharmacy and its role in the NHS?
I think, I'm quite lucky. Wes Streeting, the Secretary for Health and Social Care, Secretary of State for Health and Social Care, is my MP, and I have the opportunity to speak with him regularly. And the hope I have is that he absolutely gets it with pharmacy. He gets what community pharmacy can do. He knows what we're capable of. And I also think that the current contract that Community Pharmacy England have negotiated with the Department of Health, NHS England and Treasury, etc., I think it's a step in the right direction. I think that, what we're looking for in the future is for more of the services to be as robust as they are. So when we look at pharmacy first, hypertension case finding, contraception from October-ish, we are going to be able to offer emergency contraception from every pharmacy in England, which I think is a game changer for women's health. And it's things like this that give me hope that we're heading in the right direction. This is something, like 25 years in the industry, and this is the first time I've seen this happen. At the moment, we have 7 different contracts across North East London for sexual health. And now it's great that, come October, that's going to be one contract nationally. And I think that's brilliant. So more services that become national would be great. Like, I'd love to see smoking cessation become a national service that's the same everywhere. So regardless of where you live, you can go into a pharmacy and say, I want to stop smoking. I want to stop vaping. Can you help me? And we're able to give that help. And it's consistent and the same everywhere. But I definitely think that the government do see our potential, and we just now need them to kind of start working on the new contract with Community Pharmacy England and hope that that again develops our potential.
And as an advisor, what excites you about Global Policy Network's mission and vision, and excited you about getting involved?
Yeah, I think obviously, Amina, I've worked with you in the past, and when you approached me, I think I was really excited because it's just another platform where we can share our views and opinions. We can get some of the industry leaders from all different sectors, who want to hear our thoughts and listen to us, and it's just about sharing, isn't it, with more and more people, everything we can do. And what I love about this being global is that actually we're very, I've been talking a lot today about what we do in North East London and what we do in England and London. But actually there is some best practice across the world that we can share, what we do here and what they do in other countries as well. So I love the global part of this organization. And for me, it's just about, bringing people together, having somebody like you leading that, but bringing people together so that we can absolutely, share best practice and get the best information and knowledge from the best people.
And you're chairing a pharmacy policy roundtable for Global Policy Network as part of our series into the UK-focused roundtable series on the future of pharmacy in the UK. Your roundtable is on the 8th, on the 1st of July, and it's called The Potential of Scaling Independent Prescribing in Community Pharmacy. What excites you most about this particular roundtable, the topic, and the senior leaders that you've got joining you on the roundtable?
Yeah, so this coincides actually with the trainee pharmacists start their training year towards the end of July, beginning of August, and this time next year, or July, August next year, they will be coming out, finishing their exam, and they will be fully trained working in a pharmacy as an independent prescriber. So we know that this is the future, and that's obviously going to follow on. So what we need to do is, obviously, the people that currently are pharmacists that aren't independent prescribers, we want to try and get them to that same level. But the reason this roundtable excites me is because we've got some amazing guests on there. So Reena Barai, Olivier Pickard, Jignesh Patel, and a few other people that we're speaking to at the moment, who are going to talk about their experiences as independent prescribers. And some of those are pioneers in independent prescribing. So they did the course very early on. They're using it in their practice, and they are also part of the independent prescribing pathfinder that the NHS is a service that we're working on at the moment, kind of piloting to see, what we can learn from it. So I think we've got some of the best people that are going to be on the panel talking about this topic. And I think that it's important that, we have health leaders from all other organisations join us so that they can see how independent prescribing works in practice. They can also see, I suppose, what the challenges are about getting everybody to that level, but they can also see the potential around why we should have independent prescribers in every community pharmacist, and how the government can utilise those independent prescribers to deliver services in a place that's really accessible. And, as I keep talking about community pharmacy, weekends, late nights, etc., we need people to see what we can offer. And I think this roundtable will really help demonstrate that.
Thank you. And as part of the Policy Roundtable series, you've been working quite closely with some of our fellows, such as Isiju, who is a pharmacist in Nigeria, and others. Why do you think that early career mentorship and policy expertise is important to ambitious individuals?
Yeah, I think that, it doesn't have to be early career mentorship. I think mentorship is so important in any career because, you start your career, you start working a certain way. And if people don't, talk to you about what you could be doing differently, what you could be doing better, what you're doing well at, you can get demotivated quite quickly. And I think for people that are ambitious, they want to know that they're following the right track. But also, as well as having kind of leaders who are line managing you, you almost need that mentor that you can just be really open and honest with and kind of go, I did this today and I'm not sure if I messed up or if I could have done things differently. Can you talk me through it? What are your thoughts? So it's that kind of mentorship and coaching and that expertise. I think it's just so important throughout your career. It doesn't just have to be early on in your career. It needs to be throughout. But I really would urge everybody to have a mentor in their career and make sure that they're speaking to someone who isn't necessarily their line manager, who doesn't work for their organisation. I have trusted individuals that I can talk to when I'm kind of I guess pondering something in my mind, like, am I heading in the right direction? Should I be doing things differently? What are your thoughts? That sort of thing. So it's really important to have people to turn to.
Okay. And who would you like to hear and see on this podcast series? Is there anyone in particular, an organisation that you think we need to reach out to?
What I'd love to see, I suppose, is we're doing some work with some of the pharma companies on point of care testing at the moment. So I'd love to see, maybe someone from Roche Diagnostics to come on and talk about what they're doing. They're doing a lot of work with King's Fund as well at the moment. I'd love to see people like, Sarah from the CEO of the King's Fund to see kind of what's happening in their world at the moment. But definitely like some of the kind of key senior people in pharma and other organisations, like someone from Diabetes UK, to talk about, I guess, the role of pharmacy in diabetes, or just generally, what's changing at the moment in diabetes. There's so much information out there that if you are someone who is suffering from long-term conditions, I think with the amount of podcasts, social media, it's hard to know what's right and what's wrong. So I think sometimes having some senior officials from organisations that, charity organisations or organisations that work with these conditions, it's really important just to have them on there so that they keep grounded about what's happening on the ground and what people are, the viewers or the listeners are thinking and saying, but also for the viewers and the listeners to sort of think, okay, this is an individual that maybe I should find out a bit more about their organisation and maybe follow their website because we know it's the right one to follow. So yeah, that's what I'd love to see.
Thank you. And what can listeners expect from you and your work at Global Policy Network?
I think just that, you know, I'm a massive, massive advocate for community pharmacy and pharmacy. And I think that, you know, it's not just about pharmacists, but we've also got like pharmacy technicians who are brilliant and doing some great work out there. So for me, I think it's about really, I suppose, just continuing to be that advocate. Maybe, you know, as part of my work with GPN, looking at what other countries do, as we said before about globally, is there anything that we could bring back and share here? And, you know, I'd want to be that person that can try and make that happen, even if it starts at a local level, but then we build it up because we've trialed it or piloted it in our area. But I think for me, it's just, you know that I will listen. So if anyone out there has got any ideas, wants to reach out to me, then feel free to do so, because I'd be happy to kind of talk it over, get some thoughts, ideas, and obviously bring it to you, Amina, and the rest of the team to see if it's something that we could look at. Yeah.
Thank you so much for your time, Shilpa. This brings our episode to a close, and we would love to have you back, and no doubt we will. So I'd like everyone just to follow us and to join us for our next episode as well, where we're going to have our next advisor, Yusuf Ahmed, who's the chief pharmacist from Frimley ICS, join us on the podcast. So do follow us on LinkedIn, Facebook, Instagram, and we'll be having captions of this episode on our YouTube. Thank you, everyone. Goodbye.